Hi everybody, it's Nichelle here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content and you love what you're hearing on the channel, please be sure to subscribe. Today's topic is going to be about circumcision, especially when we're talking about infant baby boys. This I know is going to be very controversial. This I know a lot of people are going to want to argue with me about it. We're going to laugh together. We're going to cry together. We're going to argue together. We're going to do all that stuff. But what I will not do is be quiet about the reality of this procedure, especially for the sake of these young boys. So I just want to start off by saying that circumcision is a cosmetic surgery. It is in no way, shape, or form medically necessary. You can look on any hospital report, bill, whatever the case may be, but it is not a medical necessity. It is cosmetic. It is strictly done most of the time when we're talking about medical in the medical world, for the appearance of the penis. Now, for a certain population of people, it is done as a religious ritual or some type of religious sacrifice. But let's keep in mind to be respectful that we don't all share the same religion, right? All of us are not, or we do not practice the same faith or the same beliefs and structures. We don't of the people who actually believe in this practice. So I'm not taking anything away from anyone who feels strongly about this, who feels that they are doing something right. If you feel in your heart of hearts that this is something that you chose to do, for whatever reason it is, and you feel confident about that, then this message isn't for you. This message is for people who are struggling with trying to decide whether they want to do this or not. But we're just going to talk about the reality. The reality is that this procedure is very much traumatic for the infant child. An infant child cannot go under anesthesia at that early of an age. So some sort of mild local anesthetic. Sometimes nothing is used. Sometimes they're just given sugar drops and a spray that may numb the outer layer of the penis. But there's really not much they can do for pain when we're talking about digging into these multiple layers of foreskin on this little baby's penis. And so for me, that is harsh. That is really traumatic. It is mutilation. It is against their choices. Like, they have this is body autonomy we're talking about. Like, and yes, for those people who are going to be like, well, did you get your baby's ear pierced? No, I did not. My children have the right to choose whether they want to pierce their ears, whatever. So I do believe in body autonomy. So just to go into a little bit of background about this, a lot of what we think about this procedure is pretty much, I just don't see. So a lot of the background comes from religious practices. And again, I talked about how all of us do not practice the same religion. So that's one thing. And then a lot of times too, back in the, early, before industrialization and all of that stuff, circumcision was a way to distinguish the peasant people from the more the people who have more social status or higher social status. or the upper echelon people, or whatever, whatever terms you choose when distinguishing between the classes of people. But this was a way to distinguish this. Um, and there's other reasons that you can find in histories. I know there is a paper done by Doyle back in 2005. I think it's a research paper. I think the title was A Brief History About the Ritual of Male Circumcision. And for me personally, it's like, if you don't agree with female genital mutilation, then I feel like you also shouldn't agree with male circumcision, because we are basically removing the same part of the body in both procedures. This is a very highly sensitive part of the body. You are taking away tens of thousands of nerve endings from this child. He will never be able to fully feel orgasmic pleasure without his whole penis. Yes, he will feel some sort of orgasm, or he will feel some sort of pleasure from his circumcised penis, but it will never be fully capable of feeling all that he could feel in his sexual life when he is an adult, because his foreskin and his layers and nerve endings of skin have been removed. So a lot of this stuff is not talked about when we are discussing this surgery. It's just like, it's normal, we just do it because it's a practice that we think is supposed to happen. Now, let's keep in mind, the male circumcision rate here in America is higher than pretty much the rest of the world. I don't understand how we've gotten to that part, because the people who are like the cultures that originated these ritual practices were not Americans. But it is what it is. So I literally am just here to talk about the trauma. Now let's talk about the neurological effects. I know people are like, oh, like the baby doesn't remember the pain. I'd rather get it done now, and as opposed to getting it done later because it's horrible and blah blah blah. But they may not remember the physical pain, but there are studies, research done that circumcision recalibrates your child's brain, their neurological functions, the frontal part of the brain, other parts of the brain are affected. But this is something that will affect them long term. These studies have been shown that the way that the brain was before the circumcision and the way that the brain is after circumcision, it does not return to the way that the brain was when the baby was born. And this is all the way up to a year out. So we got to think about this stuff. We got to think about the long-term effects of something like this, because we often say we don't see the effects. Yeah, because we're not inside of a brain and we can't see what's going on. But the effects are there. They change after that. They are much more disconnected, much more lack of emotion. It's a whole lot of stuff that plays into it. And then we also got to figure out, we got to look at the society that we live in. We're already teaching our young men to not show their emotion, to not be vulnerable, to be tough, and to be proud, and to not cry, and all these other things, on top of these neurological damages done from this procedure. And then we always want to talk about toxic masculinity and this and that and the third, but we don't want to look at how we started the process of these particular things. So for me, again, I'm going to drop some links and some articles and things that people can read, because obviously I'm always a person like, hey, don't just take my word for it, go dig. There's also a group, I think it's on Facebook, called Your Whole Baby. Of course it's going to be people's opinions versus people's information and evidence and research and stuff like that. But that's any group that you go into, so you can go in and decipher what stuff you want to take from and blah blah blah. But again, this information is for people who are seeking answers, who want to know, hey, instinctually, I don't feel like this is something that I want to do, but I think I should do it because this is something that everybody else does, or this is something that my doctor said I should do. And then another thing too I want to talk about before I go. People say crazy stuff. Like, to me it's crazy. To other people it might not be crazy. But oh, like when you get circumcised, it protects you from it helps reduce your chances of UTIs and HIV and all of these other things. And I'm like, how? Like that doesn't even make any sense. You are exposing more of the internal glands and the internal flesh of the penis, so that when it's touching surfaces or when it's going into a vagina and the fluid is mixing, it's very close. I just don't get that. But first of all, the percentage of UTI between the two, circumcised and uncircumcised, 0.1, 0.01. That is not a big difference. I'm sorry. I'm not going to be talking to that. But anyway, let's just go ahead. There has been people and writers and doctors in earlier times who claimed that circumcision was a way to cure alcoholism and kidney disease and other issues that have nothing to do with that. So if we're looking at the fact that something says it does something, we got to look at the fact, how old is this research? What are the numbers now? We are seeing so many people with erectile dysfunction, HIV. The numbers are climbing. Yes, we can maintain it more now because we have medicine and advancements and all these other things, but these numbers are not at all changing. Again, America, we are the sickest society amongst the developed world, but we have the most circumcised men. And so I know I'm getting off track, but when I'm starting to see these numbers, it's like, come on, the information it's not matching. It's not adding up, but it's not matching up. And I just feel like instinctually, will you be able to stand there and watch your child be strapped to some kind of plastic or metal contraption, hand strap, feet strap, and watch them get their penis severed and scream to the top of their lungs? You would never be able to do that. So why do we make it okay? Why do we make that practice okay? That's the question. If you have questions, if you have concerns, if you want me to dig more into the topic, if you have a topic that I haven't already talked about that you would like me to talk about, please drop it in the email at birthuhura@gmail.com. That's pretty much my take on baby circumcision, because yeah, my heart really hurts for these babies, but this is what it is. And so I will see you guys for the next video. Again, please do not take my words as if I am judging or bashing anyone for doing what they thought was necessary, or doing what they thought was something that they should do according to their faith. If you felt in your heart of hearts that you were protecting your child, you felt in your heart of hearts that you did the right thing, then that's one thing. But I have had people say, I just don't want my child walking around with an uncircumcised penis, as if they weren't born perfect. And we, again, if a lot of us are looking at the idea of or God, or whatever the case may be, is if it's saying that we are made in his image, or we are made in God's image, then why would we be made imperfect? But that's just another thing. So again, my name is Nichelle. I am a full spectrum holistic doula at birthuhura, and I will see you guys for the next video. Peace and pregnancy dust.